Hello, I am a retired elder abuse investigator. I'm also a retired nurse and administrator. And I think I've seen everything and heard everything well before healthcare became a problem. But now that it is such a problem today, I'm going to take you on my journey of seeing healthcare on the other side as a patient and a loved one. But I'm also going to take you down a path of what you can do about some of the atrocities that we come across in healthcare. People are experiencing bad things and don't know what to do about it, and lawyers are no help. They're not taking malpractice cases any longer. It's become too expensive for them, especially with the cap on it. So now people are left just throwing up their hands and saying, what can you do? Well, there's a lot you can do. It turns out that you can do more than you ever thought you could do. There are regulatory agencies for doctors, lawyers, hospitals, clinics, lab techs, x-ray, you name it. There is regulatory agencies in place. The problem is people don't know how to get to them, don't know where they're at, don't know how to complain. And I'm going to help you do that. I'm here to teach people what they can do about the crappy healthcare practices. But I'm also here to help you learn how you can self-preserve. You have a right to stand up for yourself, and you should stand up for yourself. You need to be your own best advocate, because you don't have to go to a doctor and just do what he says. I mean, the days where we trusted them and we were sure they had our best interest at heart, those days are gone. Those doctors aren't around anymore. Those old doctors aren't going to climb up 3 flights of stairs to make a house call anymore to save a sick child. Those days are long gone. Doctors today only know pharmacology, and that's what they want to do. They make a lot of money in pharmacology. They can't get kickbacks anymore. That's been outlawed. But they get vacations and fine dinners and all kinds of expensive goodies that they couldn't afford otherwise. The same way with nurse practitioners and physician's assistants. They get to address a class of one and earn money. They get to talk to somebody about all the new medications that are out. The fact that somebody is working for the pharmaceutical company is beside the point. They're still getting paid for it. There are kickbacks. Don't kid yourself. There's lots of kickbacks. They're just not called that anymore. And these kickbacks are disguised in gifts. That being said, you have to know that going to a doctor or a provider can be dangerous if you don't protect yourself. And you have an obligation to protect yourself. They're going to give you pills. They're going to give you medications. And have you ever gone to a provider's office and they walk in a room, they're carrying a laptop, and the first thing you do, they've got their head in this laptop looking for what they can give you. If you say, well, I take this medicine and it makes me dizzy, they're going to give you something for the dizziness. If you say, well, I take this medicine, it makes me a little nauseous, they're going to give you something for the nausea. So they're masking the symptoms with more medications. So now you've got medications for medications for medications and so on. And how is that going to help you recover? It's not. Most of the medications today are interfering with the receptors in the brain. And they're hollering about, well, Alzheimer's. What is causing Alzheimer's? We need to really be looking at that. And I understand there's some studies underway right now for a lot of sound waves to address Alzheimer's. And if it turns out to be a good thing, it'll be a way to treat Alzheimer's for sure. But all these medications, they're not going to help. For years, they were giving medications to patients who were losing their memories, Aricept and so on, and they weren't doing anything but helping them go a little bit faster. It's just like putting someone in a nursing home. The first thing they get is an Advil cocktail. Well, after so many years, you find out they had enough Advil in their system to bring down a 1,500-pound horse. This kills people. But it doesn't matter. They bury their mistakes. It only matters when someone like me comes along, looks at the chart, looks at the autopsy report, and starts pointing things out. And when we testify in court and we quote the statutes, they get a little nervous. Well, of course they get nervous. They know they're breaking the law when they do this. They do it anyway, because 46 million elders in this country don't know the law. So they're not going to do anything about it. They can't sue anybody anymore. The government's put a cap on that. Malpractice, it's just not going to happen unless you've lost a limb or you die while they were treating you and your spouse sues. There are no malpractice cases anymore. If it's not worth millions, lawyers aren't going to take it. They have too many expenses they have to put out to take that case. So it's not cut and dried any longer. It's getting terrible, but there are ways to sue. There are other things you can sue for you just don't know about. There are places you can complain, you just don't know about it. For every healing arts, there is a disciplinary board available. So I'm going to teach people what they can do. I'm going to teach them what they can do about the bad things, and I'm going to teach them some of the simple things that they can do to avoid big pharma. I've used all of these things. I had a stroke. I was diagnosed with diabetes, hypertension, AFib, CKD, neuropathy, you name it. It took me a couple of years, but I reversed everything. And I didn't do it with medications. I did it the old-fashioned way, the way our ancestors did. When I came home from the hospital, I started researching. I found IIN, the Institute for Integrative Nutrition. I immediately signed up. I took their program. I graduated. I became a certified health coach. And I applied all these principles to my own self. And I recovered myself. I got my balance back. I reversed diabetes. I reversed neuropathy. Today I'm healthy. I feel better than I have in years. And I'm 80 years old, believe it or not. And you can do it too. Anybody can do it. But the medications slow you down. When you go to a doctor's office or a provider's office and they say, well, your cholesterol's high, I want to give you this. Ask them why. Why? And do you know that cholesterol causes memory loss? The statins are actually causing memory loss. Why would you give me that drug? They don't know what to say. They just say, well, you just need to take it. And if they give you something for your blood pressure, they'll tell you, this for the rest of your life. You have to take this forever. No, you don't. I'm here to tell you, you don't. You can learn to stabilize your own blood pressure. Because a lot of blood pressure is caused by high cortisol. And those blood pressure medications don't do a thing for high cortisol. Not a thing. So, but it's a way for them to make money for every script they write. That puts them in a higher category for the kickbacks and the prizes and the goodies. That's what medicine is about today. It's not about helping anyone get healthy. It's not about healing. It's about masking the symptoms with pharmaceuticals. And then you mask the symptoms from the pharmaceuticals with more pharmaceuticals. They don't heal. They maintain your sickness to line their pockets. And I'm very serious about that. They know they're doing it. A lot of them, they don't know what to do. They get out of med school and they find themselves in this predicament. They have to pay all these student loans. They have to pay for their practice that they're opening, and they're not making the money. So they fall into the pharmaceutical trap of the kickbacks and all the goodies. And it's the only way they can make any money. Look at the retina specialists putting needles in people's eyes. And they say, well, this will help. But do you know that only 1/3 of the people who receive those shots actually benefit from them? 2/3 of the people that receive those shots actually have adverse reactions, and it doesn't help them, it makes it worse. And I know because I went down that lane too. So I'm going to explain, I'm going to take one comorbidity at a time. I'm going to explain to you what I did to reverse it, how easy it is. And there's nothing, not one thing that I tell you that I did, will it be harmful. It's all common sense. It's all common sense our ancestors had. And somehow along the line, we lost it, along with the fruit stands and the healthy food. And and we turned to eating nitrates in our food. That's right. When we eat processed foods, we're eating nitrates. These are the kind of things we're doing to our bodies now. But we don't have to. We can stop. We can make ourselves better. And that's called self-preservation. And I am going to help you learn what self-preservation is. And I promise you, I have so many things available. And I'm not doing this. I'm not going to coach. I will never coach anybody. I don't want to make money as a coach. I made my money in my career. Now I just want to share what I know. My father once told me that knowledge is amazing, but it's worthless unless you share it. And I believe that. So I'm going to share my experiences and my knowledge with you so that you too can self-preserve. Follow me on my journey.